Good afternoon, everyone. This is Dr. Famuyiwa from Montgomery Fertility Center, your host of Fertile Talks. So, today I'm going to do something a little different. We're going to be talking about something that, granted, it's rare, but it's a bleeding disorder that may actually affect your fertility treatment. So, what I want to talk about is called von Willebrand's disease, VWD, and its effect on fertility treatment. So, von Willebrand's disease is one of the most inherited bleeding disorders, and it affects about 1% of the general population. So, not a lot, but a lot, but a significant amount. It's about 1 in 10,000 people. The thing with this disease, it can have dire consequences. Um, this is a disease that's caused by a deficiency or a malfunctioning of a specific protein called von Willebrand's factor. And this is a protein that's very critical for blood clotting. The unique thing about this is that women with VWD have some challenges in their reproductive years, especially if they were to need assisted reproductive technology. So let's talk about this. For instance, um, this bleeding disorder um, can affect significantly with symptoms 1 in 100 individuals in the general population, and it can also be clinically present in about 1 in 10,000 that may not have symptoms that are visible. Right. The protein, as we mentioned, is critical for clotting. What does it do? How does it um, help with clotting? The thing with the protein in it helps your blood flumps form clots after you bleed. It helps the platelets work very well. So it helps your blood form little sticky clots that can close up any bleeding site and prevent you from exsanguinating or bleeding to death, right? Um, there are three types of this disease. Type 1 is usually caused by a very mild deficiency of the protein. So the protein is there, but not in enough quantity, right? And so the symptoms are usually mild, and that affects about 75% of cases. Type 2, the protein is there. This affects about 20% of cases. Protein is there, but it's not working well. The protein is defective. It's present, but not working well. Type 3, which is more severe and is actually rare, the protein is simply not there. It's absent completely. So, and those patients tend to have more severe bleeding episodes. Now, when can you suspect someone has VWD? If someone has a history of having heavy or prolonged menstrual bleeding, especially from a younger age, that should be in the back of your mind. Someone who has very frequent nosebleeds or they bruise very easily could be another tip off. Someone who has excessive bleeding after dental procedures or even after a minor cut should be looked at. Someone with a family history of bleeding disorders, because von Willebrand's is actually inherited as a genetic disease, it's autosomal dominant. So if you have a history of bleeding disorders in your family, you might want to look at that. And then another category would be women who have severe postpartum hemorrhage. I mean, that means they bleed heavily after having a delivery in prior pregnancies. The unfortunate part is most women can normalize the symptoms until they need a fertility procedure, such as an egg retrieval, and then the problems comes to the fore. What are the implications for fertility? So while von Willebrand's does not cause infertility directly, it can indirectly affect fertility through several mechanisms. One of which is just heavy bleeding and severe anemia, which is one of the hallmarks, and this leads to iron deficiency anemia, which may disrupt ovulatory function and can also reduce implantation. It can also affect overall reproductive health, right? Other things that could happen is, which I've alluded to, of spontaneous pregnancy losses in early pregnancies. So about 20 to 25% of the patients with von Willebrand's will experience delayed, not immediate, delayed postpartum hemorrhage, which is 15 to 20 times more common in the general than is more common in the general population. So these complications should be borne in mind when they're going for pregnancy planning, fertility planning, and of course, we talked about genetic considerations. It's autosomal dominant, meaning that 50% risk of passing on the defect to your offspring. So definitely these patients need some genetic counseling as they go through their fertility training. So what brought this to my notice is there are specific risks involved with patients who are going through IVF and have von Willebrand's. And this include risks involved around ovarian stimulation, the procedure itself, right? The embryo transfer. With daily injections, daily subcutaneous injections, patients may get like hematomas or prolonged bleeding at the injection site. But the scary part is women who during retrieval, right? So during retrieval, you're getting your follicles aspirated transvaginally under sedation. There could be a risk of significant bleeding during this procedure. And some women have had such severe hemorrhage that they've required hospitalization. Hematoma accumulates somewhere in the space or abdomen from this. A rare but very life threatening complication during stimulation that requires immediate medical attention would be symptoms like sudden pelvic pain or pressure. And that's when the ovary itself, there's a hemorrhage from the ovary itself. That can be bad. Other considerations including during the transfer, manipulating the cervix of the uterus, although it's not as invasive as doing a retrieval, but patients may have bleeding from manipulating their cervix, so something to work about. So, how do you safely proceed with treating these patients? The key thing is it's got to be properly planned and it's all about teamwork. And here's the team. The team involves a hematologist, someone who's a specialist in blood disorders. These patients need a comprehensive pre IVF workup, including measuring the von Willebrand antigen, aristostatin cofactor activity, factor VIII level activity needs to be assessed to determine the exact type of von Willebrands they have and the severity, and that will help guide the management that is used. So for type 1 or mild cases, there's something called DDAVP, which is desmopressin, can be used to transiently elevate the von Willebrand factor protein and factor VIII levels. For moderate to severe cases, your type 2 to 3, these patients may actually need concentrates that contain factor VIII to be present. Um, So the key word is a personalized prophylactic plan in collaboration with a hematologist is needed. They have to be closely monitored throughout the treatment. Everybody on the team needs to be aware. In extreme patients, it doesn't mean they cannot get fertility treatment. It may mean that they may have to, for instance, get their retrieval done maybe in a more advanced clinical. You have any bleeding problems, you have help. Um, and then they need to be monitored for evidence of delayed bleeding complications. During pregnancies, the von Willebrand factors levels will increase, but then they also drop sharply postpartum within 14 to 21 days. So that's why these patients may present with a delayed postpartum hemorrhage. And those patients are more likely to require blood transfusions after childbirth because of this. So, how do we help with all of this? It's just really bridging the gap, having people like me, a reproductive endocrinologist, working very closely with our hematologist colleagues to tailor a plan to our patients. And I think physicians should be vigilant in screening patients for if they've had symptoms that I've mentioned before, such as a history of heavy menstrual bleeding, and this should not be normalized, but should be looked into right away because delaying the diagnosis can yield a worse prognosis. So, in conclusion, von Willebrand disease poses significant challenges both for fertility and IVF treatment due to the increased bleeding risk, but these can be effectively managed with appropriate medical intervention and, keyword, multidisciplinary care. So, women with von Willebrand should undergo thorough evaluation and planning with a hematologist and reproductive specialist to ensure safe and successful treatment strategies. And I dare say we should include the maternal fetal medicine, the perinatologist in the middle of all this because then they have to worry about delivery complications. So they need to be aware. Thank you so much. If you have found this very useful, please like, share, subscribe. Thank you for listening. This is Dr. Famuyiwa again.